Hi friends, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we will discuss about the CMS 1500 form and basic terminology. Okay, now we will discuss about the terminology CMS. CMS stands the Centers for Medicare and Medicaid Services. So generally the CMS is a federal agency within the US Department of Health and Human Services. This CMS is administers the Medicare program and works in partnership with the state governments to administer Medicaid, to administer the state children's health insurance program and some other health insurance companies. The CMS provides health coverage to the people through the Medicare, Medicaid, and other health insurance marketplaces. The CMS, previously known as a HCFA, Healthcare Financing Administration. So, guys, please note that the CMS is type of agency, is a federal agency. This agency is giving administration to the Medicare, traditional Medicare, and state Medicaid and some other insurances. And we have to understand the point. The CMS manages the administrative simplification standards of a Health Insurance Portability and Accountability Act. So the CMS is HIPAA administrative simplification standards, nothing but the information which is already available with the CMS is subject to the HIPAA. So it's nothing but it's a Portability and Accountability Act. So every medical information is a privacy. They have the rule of privacy and security. So that is what the CMS is also subject to the HIPAA administrative simplification standards. This is about the CMS. Okay, now we will discuss about the terminology NUCC. Here NUCC stands for the National Uniform Claim Committee. Here the CMS 1500 form is published in cooperation with the National Uniform Claim Committee by the American Medical Association. Here the NUCC is responsible for the design and maintenance of the CMS 1500 form. Okay, now we will discuss about the FECA terminology. FECA is known as stand as a Federal Employees Compensation Act. So here the FECA provides workers' compensation coverage for employment-related injuries and occupational diseases. For example, you are working any organization, and if you got an injury related that particular company or company premises, at the time the compensation is giving by this uh, FECA, that is known as a Federal Employee Compensation Act. So they are giving some compensation for your injury. So the injury related diseases will be covered by this compensation act. So here also I give an explanation for BLBA Act. The Black Lung Benefit Act. For example, if you are working in a coal mines and if you got disease related to that dust and related to that coal, then the BLBA Compensation Act will give the compensation for that coverage. And also I given here COBRA Act. COBRA is nothing but the stand as a Consolidated Omnibus Budget Reconciliation Act. Here the COBRA is nothing but it is giving continuous health coverage benefits to the covered person, even that employee lost their job. So that is the good benefit of this COBRA. Even the employee loses their job, the COBRA will not stop their giving benefits to that covered person. So here BLBA also giving benefits if any employee of a coal mine is got disease related to that coal. So these are the compensation acts. So just note these points. Just you have a option on CMS 1500 form, FECA and black lung in the box number 1. Please note this point. Okay, now we will discuss about the terminology ICD, International Classification of Diseases. D stands for diseases. Here ICD is designed to promote international comparability in the collection, processing, classification and presentation of mortality statistics. So this includes providing a format for reporting causes of death on death certificate. So this, you can classify your disease, you can identify your behavior of your disease, and your diagnose your they will understand what is the classification of diagnosis of that particular symptom or a particular disease. So this is the ICD is nothing but just by seeing this designed code you can understand what is the diagnosis and what is the symptom that related to disease. So here the ICD is a cluster of codes defined to describe the symptom of patients. And also the ICD is important because it provides a common language for recording, reporting and monitoring the diseases. Okay, now we will discuss about the CPT. The CPT stands for the current procedural terminology. Here P stands for procedural. So CPT is a set of codes defined to describe the procedure, also known as a treatment, rendered to the patient. So treatment is given to the patient. So the CPT is a set of codes defined to describe the treatment given to the patients. Here the set of codes is developed by the American Medical Association, AMA, abbreviated as AMA, and this coding system has been acknowledged by the Centers for Medicare and Medicaid Services, CMS. So here CPT is nothing but they are providing, doctors are providing some treatment, some procedure to the patients that will be developed. The whatever the procedure is given to the patients will be recorded, and also of that recording will be developed by some code by the coding team. So by seeing this set of code you can understand that what kind of treatment is given to the patient. So in that way the CPT is known as a the procedure or the treatment whatever is given to the patient. So guys, if you are watching my video first time, if you're not yet subscribed, could you please subscribe my channel PKR Vibes Career and Growth, and hit the bell icon so that you will get every my video as a notifications to you. And now we will discuss about ICFA. I'm sorry, ICPIC codes. So yeah, the healthcare HCPCS, it is abbreviated and it is stand as the Healthcare Common Procedure Coding System. So this is also produced by the CMS, and here HIPAA is a collection of standardized codes that represents the medical procedures, supplies and products and services. So in addition to the services, this HCPCS code also represents the product, what kind of product is used for that particular service, and also represents the medical procedures and what kind of procedure is taken to give the treatment to the patient, and also supplies, what kind of supplies is used to give the service to the patient. These all things will be known by seeing the HCPCS codes. So these are about the CPT and HCPCS procedure codes and a claim form. Okay, now we will discuss about the terminology NPI. NPI stands for National Provider Identifier. Here P stands for provider. So NPI is a unique 10-digit identification number is given to every covered healthcare doctor or provider or professional in the United States to streamline information transferred between the doctors, clearinghouses and payers. So here the NPI is a unique 10-digit identification number for each and individual doctor. So the NPI is an administrative simplification standard of a HIPAA. So here not only NPI, every generally in CMS 1500 form, any patient information and medical information that will be subject to the privacy rule and security rule. So here NPI is also an HIPAA administrative simplification standard. Okay, now we will discuss about SSN, Social Security Number, is a unique identification number associated with a US citizens and other residents in the country. SSN consists of a 9 digits commonly written as a 3 fields separated by the hyphens. So SSN format is a 324 format. The first set of 3 digits is called as a area number. The second set of 2 digits is called as a group number. The final set of 4 digits is known as a serial number. Okay guys, now we will discuss about EIN terminology. EIN stands as Employer Identification Number, offers a standard way to identify employers in electronic transactions. Employer Identification Number are defined as a 9-digit numbers that the IRS assigns to organizations. Here IRS stands as a Internal Revenue Services, issues EINs which must be on all HIPAA electronic transactions. You can see EIN option in the box number 25, that is associated with the tax ID number on CMS 1500 form. Guys, if you felt this video is useful to you, could you please like this video so that this video will reaches more needy people. And thank you for your watching. Thank you for your time. Have a good health. Bye for now.